Good evening. My name is Dr. Georgie Abraham. I am a consultant nephrologist at the Madras Medical Mission Hospital, Chennai, and a professor of medicine at the Pondicherry Institute of Medical Sciences. I have with me my colleagues and friends who are going to speak and interact about the treatment for end-stage kidney disease. End-stage kidney disease is a major issue in developing countries, and especially in India with the massive population burden we have along with end-stage kidney disease. The treatment for end-stage kidney disease is called as kidney replacement therapy, and many people cannot access transplantation as a treatment for end-stage kidney disease due to non-availability of organs and because of their unfit condition to undergo a transplantation. A home-based treatment for end-stage kidney disease was introduced in India and the South Asian region in 1991, along with the support of my colleague Padma, who is sitting on the right-hand side, and also Professor Santosh Varghese, who is a professor of nephrology at the Christian Medical College Hospital, Vellore. And on my right-hand side, who has been doing peritoneal dialysis. The treatment is called continuous ambulatory peritoneal dialysis since 2003. A homemaker, she is the mother of a child. So I would now move on to Padma, and Padma will speak about how the treatment started in India and how we are lucky enough to have so many colleagues who are involved in the treatment of end-stage kidney disease with continuous ambulatory peritoneal dialysis. Padma, we move on. What were the initial difficulties you encountered and how did you overcome that?
Okay. During the initial period, patients also did not take the training very seriously, and because only rich could afford that time, because the non-availability of bags and catheters, they did not allow their immediate kin and kith to do the procedure for them. They didn't do the procedure themselves, and they employed maids or a third party to do the procedure.
Padma, you remember that in 1991, when we started the PD program, it was a set called OSET. It was not very patient-friendly. We all encountered problems in teaching the patient about the OSET. And over a period of years, we found that it was a daunting task for us. But now things have become very easy. And do you think that the refinement of the system and the availability of the fluid and other things have made it very easy for the patients now? Would you say that? Yes.
Yeah, you are right, doctor.
Yeah.
Initial period, since the system was very cumbersome, it was difficult for the patient. It was not patient-friendly. But as time went on, there were changes with the improvement with the system, and the patient could do it easily by themselves.
So, in short, what you are telling is that it became an easy and safe system for the patients to perform over a period of 27 years. And now it is already going to talk to us about the system has become very simple and it is safe and easy. And the catheters are also now available in India because earlier on the catheters were not available. I had to get the catheters into India. When I go abroad, I used to bring catheters from either from Canada or from North America. Now we are in a position that we have started manufacturing the catheters in Coimbatore, and these catheters are not inferior to any of the catheters you get anywhere in the world. We are very happy that the Ministry of Health, Government of India has approved these catheters, and these catheters can be given to patients at a much cheaper rate than the catheters which are being imported from outside. Now I am going to request to talk about the various steps of doing continuous ambulatory peritoneal dialysis. We will explain now how the procedure is being done, and she will also show us that what are the different steps.
Thank you, doctor. The first step in doing peritoneal dialysis in your house is to make sure that the surroundings are clean. And the second step is to use a mask. You can use a disposable mask or a cloth mask, which is hygienic. After wearing the mask, we need to go and do the hand wash routine, which is taught to us. There's a particular procedure in which we sanitize our hands. We finished the infusion. I have also closed this lock here, and now I'll be clamping here to avoid any wet contamination that might happen. And once I have also drained what little liquid is left here and close this, now I'll be clamping this. This is a mini cap that we use to lock this place. That's it. The procedure is done. This is a 2-liter bag, and at the end of the dialysis and after the whole draining, there has to be an extra to show that there has been clearance from the body. Now, the next step is to make sure that we have to check if the liquid is clear. We normally place a newspaper, and if the print is visible, it means the liquid is clear and there is no infection. If not, then there might be some foreign bodies for which we would either take a heparin or antibodies if there has been an infection. This is the end of our dialysis procedure. If the PD liquid is not clear, then we immediately inform the PD nurse, who will take a decision as to what kind of medication has to be given to us.
This is the PD catheter, comes out from tummy. This is the titanium adapter, and from the titanium adapter to this is the transfer set, because she cannot make any connections or disconnections to the catheter directly, because if there are any unsterile during the technique, she cannot remove the catheter and do it, but always we can throw the transfer set and connect another transfer set to that. And she had to hang this, the draining will take. She hung the bag here because the peritoneal dialysis happens through gravity, that's the reason, right? And she put her drain bag down, even the drainage is through gravity. The drainage takes about 10 minutes to the maximum of 15 minutes. While the fluid is draining, she will also look for the clarity of the fluid, and she very simple procedure. The inflow and outflow both are through gravity. That's the reason why she hangs this fluid up, and the draining is also through gravity. You can see from transfer set, the fluid drains like that. It takes 10 minutes to the maximum of 15 to 20 minutes. While draining, she will also look for the clarity of the bag. 10 minutes.
That's
So you continue your dance.
okay. My night dialysis I do in front of the TV as I'm watching my favorite programs. So there's a lot of convenience in doing home dialysis, peritoneal dialysis.
One exchange of PD is first draining the fluid which was dwelled in peritoneum for 4 to 6 hours and infusing the fresh fluid into the peritoneum. The fresh fluid also will be dwelled into the peritoneum for 4 to 6 hours.